Hello, my dear students and my dear nursing officers. Welcome back to your channel, Nursing Concepts by Raghav. तो आज के इस वीडियो में हम बात करेंगे आरटी फीडिंग के बारे में. ओके, सो आरटी फीडिंग क्या है, कैसे देना है, कितना देना है. ओके, और देने के टाइम पे क्या पोजीशन, पेशेंट का पोजीशन क्या रहना है, कॉम्प्लिकेशंस क्या होता है, ओके, उसको कैसे अवॉइड करना है, अपना नर्सिंग रिस्पॉन्सिबिलिटी क्या रहता है. सो वो सब हम इस वीडियो में देखेंगे. चलिए शुरू करते हैं आज के टॉपिक आरटी ऑफ फीडिंग. तो इससे पहले अगर आप पहली बार विजिट किया है तो अपने चैनल को प्लीज़ सब्सक्राइब टू माय चैनल एंड वॉच द वीडियो टिल द एंड. ओके, तो ये वीडियो देखने से पहले आप मैंने जो एक एनजी ट्यूब इंट्यूबेशन के बारे में एक वीडियो बनाया है, वहाँ पे आप वो वीडियो कर ज़रूर देखना. डिस्क्रिप्शन मैंने या उसका लिंक मैंने डिस्क्रिप्शन में दे दिया है. वो वीडियो देखो ताकि आपको पहले ये जो आरटी ट्यूब या एनजी ट्यूब क्या होता है उसके बारे में समझ सकते हैं, और उसका इंसर्शन या प्रोसीजर्स कैसा है वो सब वो वीडियो में मैंने डिस्कशन किया है. पहले आप वो वीडियो ज़रूर देखें ताकि आपको पूरा एक कॉन्सेप्ट अंडरस्टैंडिंग हो सके. तो चलिए आज का टॉपिक शुरू करते हैं, आरटी ऑफ फीडिंग. तो आरटी फीडिंग क्या है? तो आरटी इंसर्शन, आरटी का लॉन्ग फॉर्म होता है रेल्स ट्यूब, और वी कैन इट इज़ एन अनदर नेम फॉर द एनजी ट्यूब. so it is Ryle's tube, okay? RT tube or Ryle's tube. See, RT feeding means that is through the tube we will give some a food, that is through the nasogastric tube. So we will introduce a food through the nasogastric tube when the patient is unable to take orally. So that procedure we call it as a RT feeding. Okay, feeding through the tube is a RT feeding. So it is also called as a gastric gavage or eternal feeding. Gastric gavage or eternal feeding. तो इसका जो रिवर्स प्रोसीजर है फीडिंग करना, एक गैस्ट्रिक गैवेज है. अगर हम गैस्ट्रिक कंटेंट को रिमूव करते हैं तो दैट प्रोसीजर वी कॉल इट एज अ गैस्ट्रिक लैवेज. तो ये जो थोड़ा सा कन्फ्यूजन हो सकता है, गैस्ट्रिक गैवेज और गैस्ट्रिक लैवेज. लैवेज का मतलब समझ लो, इसको रिमूव करना है. गैवेज का मीनिंग है इंट्रोड्यूस करना है या डालना है. दोनों थोड़ा अपोजिट वर्ड्स, गैस्ट्रिक गैवेज एंड द गैस्ट्रिक लैवेज. तो गैस्ट्रिक लैवेज जो प्रोसीजर है, तो इट इज़ एन चॉइस ऑफ प्रोसीजर ड्यूरिंग द पॉइजनिंग. तो अगर पेशेंट कुछ पॉइजन लिया है, अगर अनएब्जॉर्ब पॉइजन को रिमूव करना है तो वी कॉमनली डू द गैस्ट्रिक लैवेज ऑफ प्रोसीजर. ओके, so these two are the words you should remember related to the feeding. Then now how to feed? What is the procedure for giving an RT of feed? See, the first thing is first thing is the position. So what position we should give? So always remember the patient should be either in the sitting position with the, or if the patient is lying down, so its head end will be elevated nearly 30 to 40 degrees. Never feed a patient in a sleeping position or in the supine position. So this makes and increase the risk of aspiration into the respiratory system. Okay, so to avoid this complication, never feed the patient in the supine position through the RT. Then head end, that is 30 to 40 degree elevation. We can say it is an semi-polar position. Then before you start the feeding, then check the placement. This is very important. Every time, for every or each feed, we should check the placement of the tube is very important. How do you check the placement? That is just by aspirating the gastric content, okay, or the residual volume. अगर आप थोड़ा एक 10 ml या 20 ml का सिरेंज लेके सो गैस्ट्रिक कंटेंट को एस्पिरेट करना है, रेसिडुअल वॉल्यूम देखना है क्या है. फिर अगर गैस्ट्रिक कंटेंट है तो उसको दैट यूजुअली कन्फर्म्स द ट्यूब इन अ प्लेस. तो इसको रिमूव एस्पिरेट करने के बाद फिर कन्फर्मेशन होने के बाद फिर वापस वही में डाल देना. वी हैव टू री इंस्टॉल द रेसिडुअल वॉल्यूम. अगर आप निकालते हैं तो इससे इलेक्ट्रोलाइट इम्बैलेंस होने का चांसेस रहता है. So that is why we have to reinstill the residual volume back into the stomach. So after this confirmation, then the food, जो food हम दे रहे liquid, usually we give the liquid foods. तो जो food का temperature है वो it should be equal to the body temperature. तो the body का temperature से जो same रहना है, otherwise the patient usually develops the diarrhea. What happens? The patient may have the diarrhea, or the abdominal cramps may develop if there is a variation in the temperature of the food that is being given through the RT or the nasogastric tube. And what we used to give the feed, we take an 50 ml syringe, a barrel syringe, in the sense we take a 50 ml barrel, a syringe barrel we take for feeding it. Then at a time a maximum of 300 ml of food can be given, means at a time. Okay, once for each feed we can give max of 300 ml, and duration between the each feeds, it should be between 2 to 3 hours. Okay, not like hourly we give the feeds. So commonly for every second hourly or for every third hourly, a maximum of 300 ml of fluid food will be given through the RTs. Then after each feed we have to flush it, okay, to prevent the clogging or to prevent the blockage of the tube by the food particles. Then for after every feed we have to flush the tube with the at least of 30 to 50 ml of water or with the normal saline. तो नॉर्मल सलाइन ले सकते हैं या नॉर्मल पानी पानी भी डाल के मिनिमम 30 to 50 ml पानी लेके at the end always. Okay, so we have to instill or we have to flush the tube with the water. Then after feeding, don't immediately make the patient to lie down. Keep the patient in the semi-fowler position to prevent the aspiration. अगर immediately अगर आप सुला दिया तो या supine position में दे दिया तो there is a reflux or the gastric content may come out. Okay, so there is a possibility of the aspiration will be there. So immediately we should not make the patient to lie down or into the supine position. So in the case of child or in the case of an infant, make the patient in the right side lying position. Okay, so right side lying position, which will help for the easy digestion. It will make the movement of the food into the duodenum very easily. So it is better to give and right side lying position in the case of pediatrics, that is in the children as well as in the infants. Suppose if you are administering the medication, so medication, whatever the medication you are administering should be crushed. So पहले इसको पाउडर बनाना है क्रश करके, then it is to be dissolved in the water. Minimum of 15 to 30 ml of water should be taken to dissolve that medication. Then we have to give it through the RT tube. So after giving, again flush with the 30 to 50 ml of water or else with the normal saline. So this is how do we feed the food or the medication. Then usually RT tube will be removed or will be changed for every 7 days. So if we use the silicone RT or the silicone NG tube, then we can keep it for up to 21 days. But normal, whatever the see these kind of RT tubes. Okay, so this is a normal RT tube. So if it is being used for feeding purposes, then it is to be removed or changed for every 7 days. So the max days of keeping the RT tube is 7 days. Remember this. And remember, so how much water we usually take for dissolving the medication, and how much water we usually take for flushing the tube. So these are all the some important points you should remember related to the RT feeding for the point of all the competitive exams. So now what complications will occur with the RT of feeding? So the most common complication, as I told, that is a diarrhea. So this is majorly because of the changes in the temperature of the food and the body temp. So whatever the food we administer or food we feed, that should have an equal body temperature or the equal temperature as that of the body. And second is the nausea and the vomiting. then tube blocking or the tube clogging, and the mispositioning of the tube is very common, and aspiration pneumonia, then abdominal distension or the electrolyte imbalances. So electrolyte imbalances sometimes it is majorly because of the, say we aspirate the contents, so that is one reason, or we may feed inadequate. Okay, so that causes the electrolyte imbalances. Then mispositioning. How do you identify the mispositioning of the tube? I told you before you give a feed, we should make the placement confirmation. Okay, so confirmation, as I told, there were so many methods. So but usually we do the aspiration method for while feeding. Then X-ray is there, then whoosh method is there. Okay, then the marking. Okay, when inserting the RT tube or the NG tube, so you will have a markings. So if the tube has come out, so if the your marked length is showing out, or it has been came out of the nostril, so that indicates that the tube has misplaced. Okay, so the blocking is, as I told, the because of the food particles, the tube may get blocked. So to prevent that, we have to always flush the tube with the 30 to 50 ml of water. Okay, so these are some complications that might occur. So remember this, most common complication is a diarrhea. Then what are the precautions we have to take? That is, as I told, again, one thing is the placement checking, then keeping the position in a position that is semi-Fowler or the high Fowler position. Then before you give feed, so make sure that the patient GI function is normal. So that is, patient has an bowel sounds or the bowel movement. So this is very very important. If the patient doesn't have an bowel movements or bowel sounds are not heard, then don't give a feed. So it is maybe there may be so many reasons, like paralytic ileus may be there. So if you give the feed, so that food may not move through the intestine, it may get stuck and may leading to the maybe intestinal obstructions may be there. So we have to assess the bowel sounds before you give the feed. Then medication, as I told, minimum of 20 that is 15 to 30 ml, or you can say 20 to 30 ml of water should be taken for dissolving, and to flush the tube, either 30 to 60 ml of water or the normal saline can be taken. This is a very simple procedure. We should remember these points uh, when you do or when you give an RT feeding to the patients. So this is a most common clinical procedures that we commonly do in the ICU settings, and even in the general ward settings also we can see some patients on the RT of feeding. So being a nurse, we should be very careful while feeding the patients, because of the aspiration. Many of the patients will go for a complication of aspiration because of the faulty feedings or because of the improper technique of feeding. Okay? So do remember these all points while you feed a patient on the RT. तो ये था आज का वीडियो. होप यू ऑल अंडरस्टूड द टुडेज कॉन्सेप्ट. अगर आपको कोई डाउट्स है तो कमेंट कर देना. अगर आपको अच्छे लगे तो लाइक करना, और आपके फ्रेंड्स के साथ या स्टूडेंट्स के साथ शेयर करना. And don't forget to press the bell icon so that you will receive my next video notifications. So till then, take care and keep working and keep studying.